I'm Sean McSweeney. I'm the founder of Apache Health. We are an RCM prescriptive analytics software company. The problem, in a simple one-liner, is providers are fighting blind. If you're familiar with the industry, you know how incredibly messed up it is. It's kind of hard to believe how little data and analytics there are, particularly on the financial side when it comes to healthcare. And the net effect is that healthcare providers are losing a lot of money. I don't have time to go through all these questions, and there's obviously more than this. But if you ask any leader of a healthcare organization if they want to know answers to these questions, and it's a resounding yes. So why is a good time to do it now? I'm sorry, let's stay on that slide, yeah. Well, first of all, it's increased connectivity and interoperability, which means there's more openness to sharing and using data. There's also a change in culture around making data-driven decisions in healthcare. Healthcare has been behind the rest of the world for decades, but it's slowly catching up, in part because money is coming into healthcare in a much greater way. Private equity, Wall Street, and other investors are owning healthcare providers, and they really require data and analytics. So status and roadmap, we have deployed an initial product release in a couple of instances. And our focus for the rest of the year really is onboarding new beta clients and making sure that the product accomplishes the goals that we're trying to, which is really focusing on quantifying the increased revenue for providers using our analytics. If you're familiar with the traction gap framework, we define ourselves as being in the initial product release phase. So that means we're before MVP. Our original investment thesis was to go in and do prescriptive analytics using machine learning, and we did do that and got a little bit of traction, but we've shifted our focus to descriptive analytics products, for example, denials management, which you can see here. And we're aggregating data. The goal is to aggregate enough data to do more sophisticated prescriptive analytics. And this is a massive obstacle that it really took us a long time to kind of figure out how to solve. And that's the reason why we shifted down to sort of the descriptive from the prescriptive. This really to penetrate that market and aggregate large amounts of data. And so these are simple analytics products that basically everybody needs. And if you can kind of see what we're doing here, it's ETL, RPA, and BI. So these are not really complex, but they fit a need that basically everybody has and allows us to penetrate the market and aggregate the data that we need. So far, in a couple instances we have out there, the feedback has been quite positive. There are a lot of competitors out there doing healthcare analytics and denials management. And while we think we may have a particular approach that's good and maybe different than what some other people are doing, descriptive analytics really isn't the end goal. No one that we know of is doing prescriptive analytics for financial transactions using supersets of data across a large amount of providers. And organizations like Draper Fisher, Jurvetson, Wavemaker, and other healthcare tech-focused VCs have indicated they can't figure out anybody that's doing what we're trying to accomplish either. So we believe that there aren't any direct competitors, but again, never say never, maybe people are emerging. So, and we can talk more about competitive differentiation when there's more time. The market size is huge. You're talking about the entire $4 trillion transaction market. And this is a product that makes the pie bigger. So we believe there's plenty of money to go around. We're a SaaS model initially for these descriptive analytics products, and we'd like to move eventually to a percentage of revenue with the prescriptive analytics, and we've tested that a little bit in the marketplace, and we'll ultimately move in that direction. Our team has significant experience in financial analytics, software development, revenue cycle management, data science, and interfaces and interoperability. And I've put in a little bit of my own money, and we've raised a pre-seed round. We do have some revenue from a legacy product where we're white labeling medical billing services, which was really the first way that we were trying to capture data for the prescriptive analytics to sort of feed that engine. We're seeking $2 million, and that $2 million is to get us to the milestone of having an MVP, which means we're attracting and onboarding more beta clients. We're getting feedback and quantifying the value of the product to make sure it's actually efficacious. We want to develop an atomic test market since we really need supersets of data to do some of the prescriptive analytics we want to do. And that's a much more in-depth conversation about how we're doing that. And we want to test a couple of revenue models. There isn't enough time because it's short to kind of get into everything we want to do, but hopefully I can answer more questions in the Q&A.